This video is for general information only and does not replace advice from your GP, pharmacist, or specialist. Always speak to a healthcare professional about your own circumstances. So, does tadalafil damage your kidneys? It's a question that comes up a lot, and it's worth getting a clear, evidence-based answer. If you've been prescribed tadalafil, whether for erectile dysfunction or benign prostatic hyperplasia, you may have wondered whether taking it long-term could affect your kidney health. That concern is completely understandable, and the evidence is actually quite reassuring. Based on large-scale clinical trials and post-marketing surveillance data, tadalafil has not been identified as directly damaging to the kidneys when used at therapeutic doses. The Medicines and Healthcare Products Regulatory Agency, the MHRA, does not list kidney damage as a recognized side effect, so there is no established causal link between taking tadalafil and developing kidney injury in people with normal renal function. Now, there's an important distinction worth understanding. Some patients do require dose adjustments when taking tadalafil, but this is not because the medication is harming their kidneys. It's because the kidneys are responsible for clearing the drug from the body. If kidney function is already reduced, tadalafil can build up to higher concentrations in the bloodstream, which increases the risk of side effects. We won't go into specific dosing details here. That's a conversation for your prescriber or pharmacist, and you should never adjust your dose on your own. It's also worth knowing that kidney dialysis is not effective at significantly removing tadalafil from the body, which is another reason why getting the prescribing right from the start matters so much for people with existing kidney conditions. Patients with pre-existing kidney disease, diabetes, or hypertension are advised to have their renal function monitored regularly whilst taking tadalafil. This is simply good clinical practice for anyone in those groups. If you have pre-existing kidney disease, or if you're unsure about your renal function, speak to your GP or prescribing clinician before starting tadalafil. They can review your kidney function, consider your full medical history, and make sure you're on the right approach for your individual circumstances. Now, and this is important, whilst tadalafil doesn't typically cause kidney damage, there are symptoms you should never ignore. Contact your GP promptly if you notice changes in how much you're urinating, swelling in your legs or ankles, unusual fatigue, or anything that feels out of the ordinary. And seek urgent medical help if you experience chest pain, sudden loss of vision or hearing, signs of a severe allergic reaction such as swelling of the face or throat, or a prolonged painful erection. These require immediate attention. Don't wait. If you suspect a side effect from any medication, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. So to recap, current evidence does not support the idea that tadalafil directly damages the kidneys. Dose adjustments in people with reduced kidney function are about safe drug clearance, not kidney toxicity. And if you have any kidney concerns or pre-existing conditions, always speak to your GP or prescribing clinician before starting or continuing treatment. If you found this helpful, leave a comment below. We'd love to hear your questions. And for more clear, medically accurate information like this, give this video a like and subscribe to the Bolt Pharmacy channel.